Hi, this is Nikki. Welcome to the GRAT Geriatric Regional Assessment Team RFP Bidders Conference. My name is Nikki Nguyen. I am the Program Specialist for King County Department of Community and Human Services, Veterans, Seniors and Human Services Levy, Older Adults and Healthy Aging Team, and I coordinate the GRAT RFP. Welcome and thank you for being here today. So what we'll be covering today will be what is the Veterans, Seniors and Human Services Levy and Mid-Behavioral Health Sales Tax, which are the combination funding to support this strategy. We will go over the HL1H GRAT strategy. We'll go over the GRAT request for proposals. We'll go over technical assistance. We will go over Zoom grants, how to apply, and we will have a chance for questions and answers at the end. Okay, so what is the VSHSL and Mid-Behavioral Health Sales Tax? So VSHSL stands for Veterans, Seniors and Human Services Levy. It was passed by King County voters in 2017 with 68% of vote. It is a 6-year property tax levy from January 2018 to December 2023. The annual budget is around $55 to $65 million, dividing among the 3 populations: veterans, service members and families, seniors 55 plus and their caregivers, and the vulnerable populations. And the VP populations include survivors of domestic violence and sexual assault, survivors of human trafficking, immigrants and refugees, people re-entering society after having been involved in criminal system, and people with disabilities and their caregivers. The funding aims to provide services in 5 results areas, which include housing stability, financial stability, social engagement, healthy living, and system access and improvement. The overarching vision of the VSHSL is to build and improve connections among the people the Levy serves and among organizations that the Levy services. The Levy operates under 3 guiding principles, which are connections, belonging, and what can only the VSHSL do. When we talk about connections, it's connections of programs, connection of clients, and connection of providers. The Levy emphasized the combined arm approach, where we aim to create a system rather than set a program in order for the 3 populations to connect in a wide variety of services they need. Examples of the combined arm approach are the senior hubs, the virtual villages, and the consolidated domestic violence hotline. There are several other hubs for the veterans as well. When we talk about belonging, we are talking about connecting isolated seniors and people to the larger communities to foster social connection and promote belongings. When we talk about what can only the VSHSL can do, so the funding under this initiative is flexible, and we aim to fill the gaps where other fundings are not available, to support programs and services to promote equity, inclusion, and creating a better community. Okay. This strategy, the funding for this strategy is a combination between the VSHSL and the MID funding. And I'm going to talk a little bit about MID. It stands for Mental Illness and Drug Dependency. It is a local 0.1% behavioral health sales tax to support equitable opportunities for health, wellness, connection to the community, and recovery for King County residents living with or at risk of behavioral health conditions. The sales tax became effective in 2008. In 2016, MID was extended through 2025. The second generation of MID services from 2017 to 2025 is known as MID 2. The annual budget is approximately $65 million. They focus on 5 strategy areas, which include prevention and early intervention, crisis diversion, recovery and reentry, system improvements, and therapeutic courts. And there are 5 mid-policy goals represented in intended outcomes. And the goals for the mid-policy includes divert individuals with behavioral health and needs from costly intervention, such as jail, emergency rooms, and hospitals. Reduce the number, length, and frequency of behavioral health crisis events. Increase culturally appropriate trauma-informed behavioral health services. Improve health and wellness of individuals living with behavioral health conditions, and explicit linkage with and furthering the work of other King County and community initiatives. So for the both the Levy and Mid, we focus heavily on equity and social justice. Our overarching goal is to ensure that our people, regardless of who they are and where they live, have the opportunity to thrive with full and equal access to opportunities, power, and resources. And equity and social justice is included in all our aspects of works, from community outreach to composing the IFP to the review panels that we will gather after the applications are submitted and program close. So we focus on that to make sure that it's inclusive and equitable for everyone. So I'm going to talk a bit about the strategy, GRAT strategy. So an estimated 20 to 25% of older adults in the U.S. meet the criteria for a mental health disorder and or dementia, and it is projected that 4.4 million older adults will require substance use disorder treatment by 2020, and that is a huge number. There has been evidence that early intervention by geriatric behavioral health specialists can effectively stem crisis and divert from more costly services such as inpatient psychiatric hospitalization, emergency rooms, skilled nursing facilities, and jail. So GRAT was formerly operated as a mobile behavioral health crisis assessment and intervention program until 2017. Based on the community feedback, they indicate strong support to reinstitute the program. So because of this, the county has decided to allocate part of the annual budget in combination with the mid funding to bring GRAT back. The purpose of this program is that it seeks a home visiting team of behavioral health and non-human services intervention experts who can appropriately assess and connect isolated seniors who are 55 and older living in King County to crisis response or general human services in order to prevent inappropriate or avoidable institutionalization and harm to seniors and others. Okay. I'm going to go briefly over the overview of the IFP. So for this particular IFP, the required scope of work as identified include assessment, intervention and referrals, consultation, multilingual and multicultural service, and timely response. And when we say assessment, we requires the entity or the applications to conduct a comprehensive substance use disorder, cognitive and behavioral health assessment using appropriate evidence-based or evidence-informed tools, and provide the necessary evaluation for seniors 55 and older living in King County. For intervention and referrals, the agencies to provide the necessary intervention to stabilize the situation and connect seniors to crisis response or general human services in order to prevent inappropriate or avoidable institutionalization and harm to self and others. And for consultation, as part of this work to assess and connect seniors to services, the funded agency or agencies will be expected to consult with psychiatry or psychiatric nursing services for appropriate recommendations, guidance, and education. For multilingual and multicultural service, where possible, the GRAT team should provide support in a range of languages as dictated by the needs of the older adults experiencing acute non-crisis events or at risk for crisis in King County. And for this program, the agency will have from 1 to 5 business days to respond to referral depending on the level of urgency. The focus populations for these strategies will be for King County residents who live in their own home, who are age 55 and older, who are experiencing an acute non-crisis event in which the referent believes mental health and or alcohol or other drugs or cognitive issues might be a contributing factor and are making the situation worse. We want the agencies to focus on historically underserved communities, low-income communities, and LGBTQ seniors. Okay. The outcomes we are looking for this program include to reach isolated seniors who are at risk for crisis or loss of housing due to behavioral health or cognitive issues and provide appropriate evaluation and intervention, to connect isolated seniors to community resources that support their ability to access services and remain in the community of choice. And resources here could mean going to the hospital to receive physical care or coordination of services from a social worker, to reduce inappropriate institutionalization and hospital readmissions, to maximize available resources by providing service coordination, prevention, and intervention, to promote health and wellness, and to reduce the likelihood of seniors experiencing acute behavioral health crisis. Looking at this is the funding table. The program supposedly runs from 2019 to 2023. Since we plan to sign the contract in 2020, an agency will, looking at the table, they will have the full amount for 2019 and 2020 for 2020 program and startup costs. And startup costs can include anticipated costs associated with expanding or building staffing, programmatic, and system capacity to fulfill the scope of work for this program. And those are the amounts, combination amount for MID and VSHSL for 2021 to 2023. The total funding for this program is $3,363,957.50. The 2021 to 23 funding is contingent on approval of the King County Council budget and continued partnership and provision of data on program performance and implementation. Okay. To be eligible for this program, although we the request is open for nonprofit organizations, community-based organizations, tribes and tribal organizations, and public governmental agencies serving communities in King County. We especially interested in proposals from both individual organization and collaborative partnerships. Small nonprofits and community-based organizations are encouraged to submit proposals. The intent of this funding is for an entity or entities to offer GRAT services throughout King County to ensure a wide geographic and cultural spread. King County intends to fund an eligible agency or agencies that meet at least the following requirement. The agency should be able to demonstrate capacity to provide a home visiting team of experts who have the appropriate licensure or credentials to conduct substance use disorder, cognitive and behavioral health assessment using appropriate tools and provide the necessary evaluation, interventions, and referrals. Okay. I'm going to talk a bit about contract requirements. Although you are not required, the agency or applicants are not required to submit a detailed, fully evaluation plan, please be sure your program model accounts for the strategy's anticipated core performance measures. And I can go over that briefly in a little bit. For data collection and reporting, we either expect client level data or aggregate and narrative reports. for the data collection and reporting, after we sign a contract with you, you will have a chance to work with our program measurements and evaluation to come up with or to work together on the PMA plan. And we will determine then whether client level data or aggregate level data will be appropriate for this particular program. So for the narrative report, the contractor will be required to submit a narrative report annually in January, and possible on top of client level data. They in addition to client level data, they might be required to submit aggregate level client data as well, based on the conversation with our PME. So for the narrative report is to share information about operations, client stories, system change efforts, and other requested information that is appropriate for the narrative report. So talking a little bit about the core performance measures. So for this particular program, when you propose a program model, make sure you consider these 3 questions. So we use the results-based accountability model for our program measurements, performance measures. And we ask 3 questions, and they are: how many people were served, which impacted by this program? And for this particular program, it could be the number of seniors engaged in GRAT program. We also ask the question, how well did your program serve people? And it could be measured by the average number of days between initial contact and home visit. It could also be measured by the percentage of seniors who identify at least one area of need in their case plan. And we also ask the question, so how are those you serve better off? And it could be measured by the percentage of seniors engaged in GRAT program who are connected to a service aligned with a need identified in the case plan. So the timeline for this IRP is outlined below. It was released to the community on October 11. The bidders conference is today. The final day for small agencies to request for technical assistance will be November 8th. The final day to submit questions will be November 15. So after this bidders conference, I will not be able to answer questions individually. You will need to submit questions either via email or via the tab in Zoom Grants, and I will compile them and upload them into I will compile them into an FAQ document and will upload them to Zoom Grants. On November 22 is when the IRP responses are due. On that day, Zoom Grants will be closed and you will be no longer be able to submit responses up there. From late November to early December 2019, responses will be reviewed and rated. And if necessary, we'll be doing interview in early December 2019. We will notify the decisions by December 2019, and the anticipated contract start date will be January 1st, 2020. Okay, so the IRP apply, like I mentioned earlier, it will be closed on 11:59 p.m. on November 22nd, 2019. The completed application package will include responses to the summary questions, responses to the narrative questions, a budget that you will be upload to Zoom Grants, and an organizational equity chart. And you can find all these documents in Zoom Grants. So for this IRP, we rate the applications based on the following criteria. You can find this rating criteria in more details in section 9 of the IRP. So the following rating criteria includes program model, organizational capacity and experience, partnerships and collaboration, equity and social justice, budget and fiscal, and data collection and evaluation. And so for program model, we will rate based on how effective your program model is and how well you intend to provide the proposed services. Does your program have a clear plan to screen, prioritize, and triage referrals? For organizational capacity and experience, we'll be looking for whether your organization have experience and capacity to provide the scope of work for this program, whether your organization have the capacity to provide services around multilingual and multicultural support. For partnerships and collaborations, we'll be looking at whether your organization have effective collaboration and partnerships with other entities to provide and leverage resources for these services. For equity and social justice, we'll be looking at whether your organization have a deep understanding of equity and social justice, and does the aspects of ESG be reflected in your program model. For budget and fiscal, we'll be looking for whether your organization has submitted a completed and reasonable budget. Is your organization being transparent around managing government funds and auditing? For data collection and evaluation, does your organization has tool for documentation and data management, and whether applicant has good method to measure success for the program? And again, you can find more details about this rating criteria under Section 9 of the RFP, which is in Zoom Grants. Okay, so this RFP has funding for technical assistance. To be eligible for technical assistance, your organization has to have fewer than 20 FTE and less than $4 million in operating budget in the prior fiscal year. If you believe that you qualify and you want to apply for technical assistance, you should contact one of the technical assistant consultants directly by November 8th. That is the deadline for you to reach out and apply. And when you if you look at in Zoom Grants, there is more information about this in attachment D. So you can find more information about that in attachment D under the library tab in Zoom Grants. Okay. So our RFP materials are posted on Zoom Grants, as I just mentioned, is under the library tab. I will be uploading the video for today's bidders conference as well as the FAQ on there regularly. So please go on there and check regularly for any updates. The questions, summaries, narrative questions, budget, and the organizational equity chart, all are in Zoom Grants, and all applications must be filled out and submitted via Zoom Grants. And this is the link for Zoom Grants if you want to access the RFP and other documents. Right. Well, thank you so much for attending the bidders conference today. If you have any questions, please submit your questions via the tab in Zoom Grants, and I will compile them into a document and will upload it up there for your review. Thank you so much and have a great day.